Sa Liton, at ang aking money partner ng game sa lahat ng bagay, Ms. Gabriel. Hi, Chel. Good morning.
Good morning, Isa. Good morning to all our mga kashikas out there. Now, we have a lot of things lined up for this Monday morning. First off, we have this new type of education, Isa. It's called College Personalized. Have you ever heard of that?
Actually, yeah.
You have? Okay, me naman, I haven't. So anyway, we're going to find out all about it later on in the show. And then after that, for our mga kashikas out there who are very much into fitness, like you, we have a feature on a center for Ashtanga yoga, hip-hop, jazz, all these really fun things. Yeah, exactly. Fun new ways on losing weight. So, yeah. So those things are actually working for you. I mean, if they can work for you, if they're good for you, that's good.
You
Exactly.
know how people market things and it's not really themselves. Like,
Exactly. Sometimes you just really need somebody to an expert. Exactly. An expert to tell you whether it works or not. Plus, he's going to be, of course, promoting dietary supplements. So I think it's very important.
And don't forget our regular segment.
Siyempre, our regular segment hindi pa rin mawawala. It's actually the Charrie segment wherein Idol is an expert on beauty who's going to be sharing with us her views on dietary supplements and, of course, post-surgical management. So please welcome to the show, Dr. Charrie Ballecer.
Hi, Doc. Of course, before we start with Dr., I want to tell you a couple of her credentials para naman mag-placate ang ating audience, ang ating mga kashika. For more than 20 years, she's a practicing cosmetic surgeon and diplomate in the cosmetic surgery. An officer for both Philippine Society for Cosmetic Surgery and Philippine Society of Liposuction Surgery, international speaker on the specialty, and also has authored several papers that have been presented here and abroad. So, specifically, you'll be talking about Vaser liposuction.
That's right.
It's the latest and non-latest advancement. And hindi na nakakatakot.
Yes, it's not as invasive, it's not as traumatic as the regular liposuction.
What makes it so special?
It goes one step higher. It's more for liposculpturing and more for really defining the contours and the curves of a patient.
Pero tinatanggal pa rin yung
Yes, but well, it uses third-degree ultrasound technology, wherein first the fats are emulsified, after which they get sucked out.
Okay, so there's less trauma.
Yes, there's less trauma on the part of the patient, there's better healing, means less bruising, and better patient satisfaction from the surgery.
Is this procedure something where you walk in and you walk out?
Yeah, no.
Yes.
Oh, really? Yes. So, a lot of mga black and blues, no more down.
Now, you may have some black and blues, but lesser. It's much lesser than the usual.
Not like before, na mukha kang binugbog.
Yeah, that's right.
Yeah, that's right.
And you have adequate preparation prior to surgery. You're adequately prepared, which means you're given hemostatics, and then at the same time you're given antibiotics.
So, pero ba nagkaka-accident when it comes to liposuction dati? I mean, we heard about all these cases that people would die. Why? Dahil hindi licensed yung mga surgeons? Or
perhaps poor training on the surgeon's part. Second is, there's, as you said, accidents. So this is just really plain accident. It could be. And third is probably poor patient preparation. Binibigla or, laboratory tests and other necessary tests have not been done prior to surgery. But then again, like, how could you predict aneurysm? You can never predict an aneurysm, the presence of an aneurysm. So there are certain iatrogenic causes. There are also causes which, are in the patient inherently before the surgery.
Because really nowadays, a lot of people want immediate results in the past. Make me beautiful now.
Exactly.
But what phase? Sige, because after all, you're also a cosmetic surgeon. Hindi na speaker to. Alam niyo naman maraming artista, celebrities out there. Mga bigla nila from time, puti-puti mo na. Or, yung ilan mo dati.
It's really no secret because they actually publicize it in ads or,
Or yung mga ilong nila, hindi naman ganyan yan dati, diba? Or next thing you know, your cup runneth over. Dahil from class to, oh, hello, curve. So, how about those? I mean, there are the ones that work, and there are the others na,
This is identical to televiewers, no? First of all, you have to assess it properly with your cosmetic surgeon, with your favorite cosmetic surgeon. Someone who's credentialed, someone whose work you've seen, and someone who's been referred to you by someone, a close friend, a relative.
Hindi napaka-importante.
In short,
ano yung work mo?
May proof na. May proof na doon sa ginawa niya. Now, if the previous patient is happy, chances are you'll also be happy.
Kasi syempre, you don't want to just,
Yeah!
face. You don't want to just jump into something without, checking out the waters, diba?
That's right. And when you do consultation, the first thing that I ask is, why are you coming here? What are you coming here for? What's the reason? Why are you consulting with me? So I listen first to the patient, after which I recommend to her, kung matangos na ilong, Doctor, I want to have higher nose. So, hindi naman bakit kayo dahil Pilipina ka. So I tell the patient.
Everyone wants an Angelina Jolie nose, right?
Or an Angelina Jolie. Instead of lips.
I have a question. I have a question, Doctor. I mean, syempre, of course, when you do those things like lipo or when you clean your nose or there's something that must happen also psychologically. I mean, is there some sort of psychological preparation that a patient needs to go through? I mean, how do you do it?
Well, I gauge it from the onset of consultation. I look at the patient, I talk to her, and from there I can really tell whether the patient is suited for that particular surgery or not.
So does that mean you've actually turned down people?
Definitely.
You felt that
because the expectations of the patient should be reasonable.
Yeah.
And whatever has been done to beautify him or her should be acceptable to both him and to you as a surgeon.
Doctor, it's not just here, of course, to talk about her comments about these procedures. Yeah. Pero what's nice is you actually are pushing something that you don't need a procedure or a treatment for. You have a dietary supplement.
That's right.
Yeah, so that's about this one, slim and white.
Okay. This came about because I noticed Filipinas would always like to be slimmer and whiter. I thought about it.
2 in 1.
Yes. I thought about it when I started to do liposuction, which was, a lot of years ago. I think that was 1987 when I started to do liposuction. And I noticed that after the procedure, they'll come back to me and they'll tell me, Doctor, I'm fat na naman. No? So I said, there has to be something to maintain them. And for those who tell me, Doctor, I'm afraid of the surgery, I have to be able to give them something naman that will reduce them.
Okay.
So there are two pitfalls. There are two pitfalls. You're not able to reduce because first you feel weak, second, you feel hungry. So with slim and white, that corrects both of it. At the same time, pumuputi pa siya.
It's a skin whitener, fat burner, anti-aging.
That's right.
Energy booster,
antioxidant, and detoxifier. So, Farah, wait, I just want to ask, if when you start taking these supplements, does it mean that you have to take it forever? Like, what if you stop? Will you gain weight?
No.
And who should take it? Can I take it as a pregnant lady?
No, you should not, ma'am.
No to pregnant women.
No to pregnant women.
But, okay, how young? 14, 12-year-olds are taking this now?
No, 18 years old.
Okay, legal
18 years old and above. The reason is because they'll be more responsible when they take it. Now, your first question was, are you going to take it forever? Not necessarily, unless you feel like, you feel that energy boost, you feel that overall health satisfaction when you're taking it. So might as well take it like a dietary supplement, like a vitamin. Yes, I've been taking it, and
men and women can take it.
Yes, definitely.
Where can they find it, Doctora?
They can find it in Mercury and other leading drugstores at Watson's as well.
Alright, thank you. Thank you very, very much, Doctora. That's slim and white. And of course, now we know at least the opinions of Doctora when if you are thinking about undergoing procedures and treatment. Sana naman po, go to those na talagang confidential. Unang-unang go to the experts. Exactly. Thanks so much.
Thank you so much. You're welcome, and thank you for having me here.
Anyway, in the meantime, Lisa, we're going to go fashion time. So let's check out what's going on in the local fashion scene, please. What's up?
Different creations in remarkable